Jim, as an experienced medical malpractice lawyer who's done this a long time, what types of complications do you get calls about from patients who undergo a surgery that involves their bowel or colon and a cut or perforation of that body part?
Well, Rick, in this day and age, virtually, not all, but virtually all abdominal surgeries are done laparoscopically through basically small tubes called trocars and cameras. It's wonderful for the patient in speeding up recovery time, but it gives the surgeon a much poorer view of what he or she is up to. Without a doubt, the most serious, life-threatening, and sometimes fatal complication from that procedure is if the surgeon cuts, perforates, or nicks the patient's bowel.
Well, if they put a cut in your colon or bowel and sew you back up and send you on your way and do not know that it was there, is that normally a violation of the medical standards or not?
As long as the laparoscopic surgeon has good enough vision to realize that he or she has perforated your bowel, addresses it, stitches it up, and you don't suffer an injury, no, that's not a case. Where it becomes a case and where it becomes life-threatening is if the surgeon does not realize the bowel perforation has occurred, they finish the surgery, you go back to your room, frequently you go home thinking everything is fine, and that bowel perforation leaks and it puts bowel contents out into the patient's abdomen, and you immediately become septic, and if it is not surgically addressed quickly, it is fatal.
Have you had a number of cases where people have suffered sepsis after this type of surgery and had to be hospitalized?
Yes, it's a terrible illness. I've actually represented the families of some people where the sepsis was so bad it resulted in death.
Jim, if the doctor is looking at what they're doing on a monitor during a laparoscopic procedure, which they all are, how can they totally fail to appreciate that they put a cut in your bowel? That's not even what they're supposed to be cutting.
Well, what you need to understand is the laparoscopic view is very, very limited, and the bowel is in close proximity to all the other organs in the abdomen. A surgeon must be diligent in making sure that he or she knows where everything is before he cuts with a scalpel or burns with a cautery instrument. And if he doesn't, he or she doesn't, and fails to realize that he or she has inflicted that injury, that is medical negligence.
Thank you, Jim.
Please go to our website at hsinjurylaw.com to immediately receive by email our free report on medical malpractice claims. If you or someone you know has suffered a serious personal injury, please feel free to contact us by going to our website or calling our 1-800 number.